Hi, my name is Tim Bentz, and this is my Quiz 6 video presentation for Bio 214, Section 2. So, for this video, I'm going to be talking about Parkinson's disease, and to start, what is Parkinson's disease? So, according to the Parkinson's Foundation, Parkinson's disease, or PD as it's sometimes called, is a neurodegenerative disorder that affects predominantly the dopamine-producing neurons in the substantia nigra region of the brain. So this causes the brain to not produce these dopamine neurons, and thus the area of the brain that controls movement becomes impaired as well. When it comes to causes, it's actually not really known what causes Parkinson's disease. Every case is different. So right now, it's actually thought that Parkinson's disease is caused by a combination of genetic factors and environmental factors, such as exposure to toxins. Next, let's talk about some symptoms. Medline Plus, which is part of the National Library of Medicine, states that there are about four main symptoms, or there are four big symptoms that you can recognize when it comes to Parkinson's disease, which are the tremor in hands, arms, legs, jaw, or head, stiffness in limbs and trunk, slowness of movement, and impaired balance and coordination, which sometimes leads to falls as well. So those are the four main symptoms of Parkinson's, but there can be plenty of others, including depression or other emotional symptoms, difficulty swallowing, chewing, speaking, urinary problems, skin problems. And these symptoms and the rate of progression of the symptoms varies from person to person. Moving on, let's talk about the diagnosis of Parkinson's. So just as causes isn't really known, it's also really tough when it comes to diagnosing it because of that. There's no one way to diagnose it, and it's hard to tell in the early stages, actually. When it comes to diagnosing, though, there are two of the four main symptoms must be present over a period of time for a neurologist to consider a PD diagnosis. It's usually made by an internist or family physician at first, and then people will usually go on to see a neurologist for a second opinion. Specifically, they might usually will go to see a movement disorder specialist. Moving on to treatment, the NIH lists plenty of treatment options that you can have when it comes to Parkinson's. However, there is no one specific cure for this disease at the moment. Instead, they have medicines, surgical treatments, and other therapies that can often relieve just some of the symptoms that you get with Parkinson's, but nothing at the moment can cure, as I said. So let's start by looking at some medicines. There are drugs that increase the level of dopamine in the brain. There are drugs that can affect other brain chemicals in the body, and drugs that help control non-motor symptoms. When it comes to therapy for Parkinson's, there's one that's the main one called levodopa or L-DOPA. It helps to make dopamine to replenish the brain's lack of supply, and is usually used alongside a medication called carbidopa that prevents or reduces some side effects of the therapy, such as nausea, vomiting, and low blood pressure. And this medication also helps to reduce the amount of levodopa needed to improve the symptoms. The main surgical treatment for Parkinson's is known as deep brain stimulation, or DBS. And this is a surgical procedure that surgically implants electrodes into part of the brain and connects them to a small electrical device implanted in the chest. This device and the electrodes painlessly stimulate the brain in a way that helps to stop many of the movement-related symptoms of Parkinson's. Other therapies, such as physical, occupational, or speech therapies, can also be used just to help with whatever symptom that people are trying to improve. So along with these methods, it is also key to have a good, healthy diet and getting good exercise, because this can help to strengthen the muscles and improve balance, because obviously that's one of the main things that is affected when it comes to Parkinson's disease. So finally, after hearing all this, you're probably wondering, who's at risk? Am I at risk to get it? Who's more likely to get it? And so it's not exactly sure what specifically are the factors for getting it, but it is both men and women can get it, and 50% more men than women actually get Parkinson's disease. There is one clear factor when it comes to Parkinson's disease. What's the risk factor? And that's going to be age. So most people first develop the disease and get the symptoms of the disease around age 60, And then 5 to 10% of people have early onset disease, which begins before 50, and that's just some of the symptoms of Parkinson's will start a bit before the normal age, which is 60, and that's called, as I said, early onset disease. So yeah, that's my video presentation, a quick overall view of what Parkinson's is. Thanks.